Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoyed today's episode. Hey girl, I hope you've had an amazing week and hopefully you have been checking out the podcast recently. This is the 3rd episode in our Pain with Intimacy series that we started in the month of February. And we first started with really just breaking down the taboo of what could be causing pain with sex and that you're really not the only one. It is not all in your head. There is usually a lot of both physical and emotional aspects to dyspareunia or vaginismus or vulvodynia or vestibulodynia or any of these kinds of conditions that really do cause pain around arousal and or penetration and intimacy. So we also followed that up last week with an episode really diving into the reality of the mental load being touched out, the impact that your nervous system has on this pain, and how getting the nervous system in a better regulated state can really be the foundational breakthrough that you need to be able to truly heal this for the long term. But today I wanted to touch more on the tactile tips and tricks that I like to teach my patients and that also I do talk about inside of my free masterclass, the Pain to Pleasure Framework, which is inside of my free app, Pelvic Floor Core and More. So go download that app. The masterclass is out. It is free. There is a journal workbook in there. There is a little workout 5-minute breath work exercise in there. And so lots of good stuff there, but it can get complicated. So if you do that, you've tried some of those tips and tools, you listen to this episode, you try some of that, you're still having issues, this is where I would reach out to me for a coaching call or come in person so we can really see your history, your condition, your goals, and really help to make a more individualized plan for you, okay? So just know that there is help out there. Pain with intimacy is common, but it is not normal, okay? I don't care if you're postmenopausal, perimenopause, 40. I've heard so many ridiculous things told to women. It is not normal. It is treatable, even if your tests are coming back normal, okay? You are not broken and you do not have to push through it. And in fact, in this episode, we'll dive in a little bit to how that could actually be hindering your progress. And so this is not about powering through, okay, friend? This is about creating safety. And that goes for really any kind of chronic pain. And so even if you're not having pain with intimacy, but you are having just pain, right? Maybe it's chronic hip pain, chronic tailbone pain, back pain, foot pain, whatever it is, then really utilize the regulation tools I talk about in today's episode, because that is just going to help your body overall. And I have touched on this in the episodes I've touched on pain in the last couple months. And so definitely go check those out. But let's dive in to why we really should stop pushing through pain first, because this is the most important thing. I have too many women coming to see me with pain with intercourse who are still having intercourse, even though it is painful, whether it is because of guilt or they feel like they should be doing it for their partner, right? Or if there is like this hope that they want it to get better, so they push through it, hoping it gets better and it just doesn't. Either way, this pain creates guarding. And remember that guarding increases pelvic floor tension. Tension creates more pain. Then the body is feeling more stressed and tense, and that cycle continues. We get pain, we guard, it creates more tension, and therefore creates more pain. So we really want to start with first helping you to redefine what intimacy might look like for you and or your partner temporarily, right? We really want to think about maybe if penetrative intercourse is causing pain, how else can we be intimate, whether it's physical or emotional, just having that connection and time. Maybe we're staying external and having some play externally, oral or digitally, and we're not going internal. Or maybe if that external stimulation is also uncomfortable, maybe intimacy looks like massages at first, right? Maybe it looks like having a nice one-on-one chat and dinner with your spouse, holding hands and snuggling on the couch, really redefining that intimacy for the moment while you are working on your nervous system and the physical body and doing these other tools I'm telling you today. Because then, yes, our goal is to get you back to the form of intimacy that you want. That is also a thing that I think that is worth defining for yourself, regardless of if you have pain or not, is what sex is worth wanting, right? And I had a lovely local sex therapist, Kat Fight, on a couple years ago on the show, and we similarly did a little intimacy series where she came on and she brought this great question up, right? What sex is worth wanting for you? And this made me think too, because it's like, well, we think of sex as just like penetrative intercourse, and there are so many other forms of intercourse and intimacy, and you really want to dive into like, what do you want? What does your partner want? How can we bring both of those worlds together so that both parties are not only having pain-free intercourse, but pleasurable and mind-blowing intercourse, all right? That is our goal. But sometimes we first need to remove that pressure, that performance pressure, right? Because this is where I hear a lot of women just get touched out. They're feeling like they want to pull away every time their husband touches them, and they don't even want to hold hands or snuggle because they know that on their partner's side, that means that they are looking for sex at the end, right? They know that, oh, that's just an invitation for them. And that is really unfortunate. So it's worth having that discussion with your partner initially to say, hey, in order for my body to feel safer when we are actually physically intimate, I first need to get to where other forms of physical intimacy feel safe. And because we've had pain with sex for so long, or whatever your story is, it might be making you feel uncomfortable with any form of physical intimacy. And so have that discussion. See if you can just take away that pressure. Hey, let's do massages, but like we're not having sex, so that both parties know, right? And there's not this like, fine, I guess we'll do this even though we're not going to have sex. Like that's unfortunate. I hope you're not having responses like that, because there are a lot of ways that we can be intimate and connect with our partners. And hopefully you are with a partner that is understanding of your pain and doesn't want to hurt you. If they are ignoring your pain for their pleasure, these are red flags, my friends. I'm sorry. I don't care how long you've been with somebody or how much you love them. If they are ignoring your pain for their pleasure, we have some issues. And it's at least worth talking to a sex therapist about, even just a mental health therapist, or I end up feeling like I'm both of these a lot of the time. And so bring it up, get some support if you need, because we really want you to feel safe and supported as you go through this healing journey, okay? You cannot convince a guarded muscle to relax by forcing it or drinking wine or just shutting off and dissociating. In fact, that's going to cause more disconnection and an reality in your body that you are violating yourself. You are violating your own truth that hurts, and you're still allowing that to happen. So your brain is going to continue to give you pain, continue to disconnect from that space to survive, right? So we first need to just really get to this place where we can have these honest communication, where we can take that pressure away, where we can rebuild what intimacy looks like in a safe and pleasurable experience, because that is what lets the guarding down. That's what tells the brain, hey, I guess I can relax these muscles a little bit. We haven't been poked and prodded and put into these positions where I've been in a lot of pain lately. So I guess that hand holding is okay right now. And then it gets better and deeper, right? Oh, okay, I guess some oral play is okay right now. Oh, maybe some digital interplay is okay now, right? Like slowly progressing back to that. But we do first need to down train the nervous system and the muscles that are holding that tone and protection for your body, and especially down training before you do any strengthening. And it is unfortunate that our providers that are just diagnosing women with pain with intercourse are many times telling them they need to strengthen, right? I get these referrals from these providers that are saying pain with intercourse, weak pelvic floor, being referred for Kegels and strengthening. And I'm just like, no. This is where Kegels and strengthening can make things way worse, okay? Not all pelvic floor dysfunction equals weakness. And in fact, in most cases, we have both weakness and tightness, but many women with pain especially do have an overactive pelvic floor, guarded muscles, and chronic tension that are going to make it so much harder to relax and calm down if you are also trying to Kegel and strengthen your way through this pain, okay? So we first want to think about some practical tools to help you down train the nervous system. You already know I'm going to say breath work. So diaphragmatic breathing, that 360 core breath, this is the key, because we are getting that physical stretch in the pelvic floor when we are getting this deep core breath. And if you don't feel that breath initially, it's probably because it is too tight, okay? And so this is where we do also talk about other manual therapy tools like pelvic wand and massage balls and even other kinds of vibrating tools to help relax muscle tension and any fascial restrictions and guarding in that pelvic bowl. But it also is tapping into that safe parasympathetic side of the nervous system by using your diaphragm. So we're doing two great things, getting a physical stretch on muscles and also helping the nervous system calm down, which is therefore also going to reduce muscle tension and the pain signals that you're getting from them. And also with that breath, if we can extend the exhale, right? A longer exhale. So I like to think of an inhale of 4 to 6 seconds and an exhale of 6 to 8 seconds. When we get this longer exhale, this is where we can then especially tap into that parasympathetic side of the nervous system. So think breath. I think this is a great thing to do, especially if we're doing them before, is like foreplay, or we know we might be getting some fun time later. So we do some deep breath work and stretching beforehand, and even maybe during penetration when you know it's going to be painful, or if you get in a position where you're like, oh, there's the spot that hurts, try this deep breath. Try to breathe into that spot. See if it releases and calms down. Now, if it doesn't and it's getting worse, this is where we need to back off, okay? And so definitely thinking of that breath, and especially if we get into what I call hip breathers. So these are positions that also help that breath not only get into the pelvic bowl, but deep into the hips of and sides of the pelvic bowl and the tailbone backside of the pelvic bowl. So we're getting more into the walls of that bowl, because this is where we can also have a lot of restriction, tight hips, tight tailbone, tight glutes, tight adductors, tight hip flexors can all cause pain with intercourse because they tug on that pelvic floor fascia and clitoral tissue. So positions like happy baby, a deep squat, getting into a nice 90-90 side sitting position, a figure 4, a hip flexor stretch. These are just stretches for your hips, but you're bringing the breath deep into that space. So you are breathing wherever you feel the stretch happening, mid back, front of hip, glute,
pelvic floor, pubic bone, wherever you feel that stretch, that's where you're breathing, and you're going to help expand and open that space really well. Supported child's pose is another great position I love because it helps open up the tailbone and the back, which can help contribute to tension in the pelvic floor space. Tailbone softening visualizations, right? Thinking of that pelvic floor like a flower that's blooming and softening open, right? And it's not a closed, tight flower. We also use visuals like a jellyfish. So we want to think about that pelvic floor blooming open, like the jellyfish's legs or tentacles are going wide and open, right? And not coming taut and up and in. So thinking about whatever visualization helps you, the flower seems to be a good one. Thinking about this around the rectum especially, and making sure we're getting that tailbone space to open up can be really helpful. But the pelvic floor mirrors the diaphragm, okay? So if your diaphragm is not moving well, your pelvic floor is not moving well. And so we need to get them both working together, where your inhale is expanding the pelvic floor, and on your exhale, it gently recoils back up. We are not kegling or tightening. We're just letting it do its thing, but we're really trying to feel that breath get deep. We really, again, want to think safety first, strength second. And many times strength isn't necessarily an issue, although I will say that once we get that pain to subside, when we start strengthening, we do start to see increase improvement in like pleasure, like orgasms become a lot better. So all pluses there, but don't go straight to strengthening, right? Because you're not going to get any kind of orgasm, especially a pain-free one, if things are super tight. And then that's where we also want to think of like external release before even internal work, because sometimes when the nervous system is way too intense, that internal work can feel very intimidating, right? It's like, no, like it hurts for it to have penetration. So why would I want to go in there with a wand or my finger or even have you do it, right? And so first we can really create some safety and calmness in the body and the pelvic floor by indirectly working externally. So getting into the glutes, the inner thighs, the hip flexors, the adductors, and even your rib cage. The rib cage really does impact the pressure and tension down below. And so using things like a lacrosse ball or massage ball or Theragun or foam roller, or even just your hands to get into the glutes, get into those inner thighs, stretch these muscles as well, and really think about things like fascia, because that fascia in those thighs pull again on that pelvic floor. And so the pelvic wand is where we do start when we want to get internal, but only when you're ready. We also have dilators. So I'm going to do an episode, our final episode in this series next week is going to be on the tools that I like to use. So I'm not going to go super in depth to them today, but just know that there are internal tools when you're ready to really help get into those trigger points that you can't reach, help open the fascia, and get into those deep hip muscles that you can't really get at externally. But slow and breath coordinated exposure with tools externally and working your way closer and closer to that vulva, to the vagina, to the rectum. But first start with your glutes, start with your adductors, start with your quads, and slowly get more comfortable with touching the vulva. Actually feel the muscles around the vulva, around the vagina, around the rectum, because that's part of your pelvic floor. And you might be surprised to find it's not all painful. Or you might be surprised to find that there is a spot that hurts that you didn't even really notice. Because then if we can just put gentle pressure with your finger there externally, or again, sit on a lacrosse ball. I do teach these tools inside of my Restore program on my app, which is a 12-week program, just so you know that there is a lot more strategies that I actually have in a program already if you are not able to come in person and learn these techniques from me. But internal work is a tool. It's not a punishment. And sometimes we even have to take away that sexual side of it, right? People are intimidated. They don't want to go internal because it does remind them of sex and they feel embarrassed or ashamed or yucky about it. And that's where we have to reframe, like, no, the pelvic floor is a muscle. This is part of your body. Your body deserves attention. These muscles deserve attention, and you're obviously having pain, so they're trying to yell at you. So we need to get on them and massage them and help open them up. And for other women, it's not a big deal. It's like, yeah, I go in there, I start working around and moving and relaxing and breathing. And then if it leads to funner things, awesome. It leads to funner things. But we're not putting that pressure on the table. And sometimes we even have to draw that line for yourself that like, nope, this is just therapy, okay? So the other thing I want you guys to think about is changing the environment, right? Like not just the body. So bringing it back to last week, how we talked about that mental part, how your brain is really learning these patterns. This is where as soon as you get into like the bedroom where maybe you are having that pain, your body might automatically start guarding and feeling gross there because that's where your body's feeling pain. So we need to first like slow things down. Maybe we're changing the physical environment, or maybe we're even just trying to reframe the environment that you're in, right? Like having the massage in that bedroom without having any pressure for intercourse, or having a lot more foreplay when maybe you didn't before. And please know, women especially, but men, pay attention. Women need foreplay. We cannot just like stick things in. It's dry. It doesn't feel great. So if you want things to feel good, help us feel good first, okay? Get things warmed up, get them lubricated. It can be with your finger, it can be with a toy, it can be with your mouth. I really don't care, but give your partner some attention and stop just putting the pressure on penetration, because another thing you should know, that's not how majority of women get off, okay? So we need a little external clitoral stimulation. Some women even need some anal stimulation. Some women need some internal G-spot stimulation. Learn your partner, okay? But foreplay is huge, and getting that arousal first mindset where we're like trying to get in the mood, get the body in the mood, and also think about like that throughout the day, right? Like it's not just over in the bedroom. Now it's time to do the thing and get naughty. It's like, no, what about through the day? We're flirting, right? We're building that tension. We're talking to each other. We're flirting throughout the day, sending each other texts, giving each other little love touches throughout the day. And then by the time you get in the room, it's like, oh yeah, now we can really just go at it. And you've been building that arousal and tension versus just getting in the bedroom with no libido and then having someone force something where you aren't feeling comfortable. Like that's hard to get in the mindset for, right? So let's start emphasizing foreplay, spread it out throughout the day, and especially in the bedroom, creating space for your mind and body to get on the same page. We need the brain to also want this. It's going to help the body also want this, create that extra lubrication, soften tissues, and then things will be accepted a little better. But also lube, use it. Stop feeling shameful around it, right? I was that way, especially in my early 20s before I know what I know now. It almost felt like oh, why is my body not doing what it's supposed to do, right? When it's like, no, that's stupid. It might be a certain time of the month, right? Or maybe it is taking my body a little time to get on board, even though my brain's like, I want this. Hello, why are things feeling a little dry down there? Use the lube, because that's going to take away the friction. It's going to make it feel good right away. And then it's easier for your body to be like, oh, okay, you're right. This does feel good, and help produce its own lubricant. So try different lubes. They're not all created equal. There's silicone-based, water-based, glycerin-based. There's all these different kinds. One thing I would suggest is staying away from the glycerin-based one, aiming for a glycerin-free, because that does have more sugar in it and it changes the vaginal pH. Not good for female bodies. And so definitely keep an eye out for the KYs and some of those more like sexually marketed ones, because if they're more for your vaginal health, that's going to be a lot better for you in the long run, okay? So definitely try different lubes, try a lot of them if you don't find a good one, but even just coconut oil can be a great one. And yes, it is totally safe and natural for your tissues and your body. And so the other thing is positions, right? Like, can we get yourself in a position where maybe you have control over the depth, over the pace, right? So this is where sometimes being on top for the woman can be helpful. Sometimes it's the most painful because it is a deep position, but that means you don't have to go as deep, right? So you can kind of slow things down, not go all the way, and then you know the pace. So it kind of takes away anxiety out of your body where you can just kind of calm down and be in the moment. But play around with positions. Don't be afraid to have fun and try different things, right? And especially if it's going to lead to more pain-free and even pleasurable experiences for you. But there are especially benefits with trying like side lying or just even avoiding that deep penetration early on, which again, there are some tools for that and some cool little things that have come out in the healthcare, women's health, pain with intercourse world that I will talk about next week for sure. But this is not regression, okay? It's rebuilding. And if you just keep powering through and having sex while it's painful and doing breath work in between and trying to do release work and wand work and all these other things, but you're still just powering through painful sex, you're going to be taking like 3 steps forward, 2 steps back. It can be so much more beneficial in the long run to really slow things down and rebuild that trust. And then starting with that graded exposure as things start to feel better, right? So start small, take that goal of penetration away, reintroduce sensations safely, right? External touch, starting with maybe yours, and or having that open communication with your partner about just staying external and gentle, and you help guide it. And hopefully that does create more pleasure for you that then helps you feel more confident next time that, hey, maybe we just have a little stretch at the opening with your finger and we see how that feels, right? But also celebrate these neutral experiences, like celebrate just kissing, celebrate holding hands without feeling grossed out by your partner, celebrate those cuddles without that pressure of having to have sex and intercourse, because those moments are also precious, and our connection with our partner should not be defined by how many times we have penetrative intercourse, okay? And so this is where we really want to just create that space for you where you can touch without expectation. You become more of like, you're focused on the senses and versus the goal of the outcome, right? And we're helping rewire the association of pain in your body. That neuroplasticity in your brain is real, and the brain can relearn safety if you're doing it safely, right? And then that calms the pain pathways where we're not getting those lighting up all the time. But sometimes, again, we try those things and we still end up having some issues and pain. So this is where I do want you to seek professional help and get clear guidance and see a pelvic floor PT, even if it's not me, especially if your pain persists beyond a few months, you have a tearing history, right? Or even a trauma history, a sexual abuse history and trauma. This can really complicate things. Maybe you suspect scar tissue restriction. Maybe you've had tearing or an episiotomy or C-section or hysterectomy or even a gallbladder or back surgery can affect the fascia and the tension in this pelvic bowl space, all right? But also if you just have severe guarding and if you avoid intimacy entirely because nothing feels comfortable and you're just super afraid of it, this is where you really want to seek help, okay? And Restore is great for education, breath work, nervous system regulation, gentle progressions into exercise, but one-on-one PT is definitely better for complex trauma, severe pain, scar mobilizations, and other hands-on assessments that might need to be looked at. But just know pain with intimacy is not a sentence or a lifelong diagnosis. It's just information that you're getting from your body. And when you listen to it, instead of overriding it, your body actually starts to respond, okay? So again, healing is possible, and not only to become pain-free, but pleasurable as well. So pleasure is possible. Confidence is possible. And I want you to know that I am here for you. So definitely reach out. I have all my information in the show notes below. Let's get you on a coaching call and really dive into your story so that you can start today and really start to feel confident, break those walls down, help rewire your nervous system, and get you into those pleasurable experiences that you desire so much. But otherwise, I hope you found this helpful, friend. Please share with anyone you think that would benefit. These are really taboo topics. And also, please leave me a 5-star review if you haven't already. In the bottom of my podcast page, you will see the place that you can leave a ranking and or review. This is the lifeblood of a podcaster. It really helps me continue to show up and be seen in front of other people. So I really appreciate it. And as always, if you feel so inclined to share in your stories, I love seeing the feedback and seeing who's listening out there. But I hope that this helped you and brought a little hope to a place that you might be feeling really isolated and alone in. But otherwise, have a great weekend, and we will see you next week on the Pelvic Floor Core and More show.
Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.